Usama, for the invitation. And this presentation is going to be about just a general presentation about pathology, how it has evolved as a field, and what have we learned over last few years to make progress in the field, and especially for people who are at undergraduate level or house officers, they are yet to decide why they have to choose pathology. So this presentation is going to be an introduction to actual field of pathology rather than going into very technical details of it. So this is my, let me check. So this is my institute, Shaukat Khanum Memorial Cancer Hospital. As you know, this is one of the leading cancer institutes in our country. And as a result of it, we have the highest workload as far as pathology is concerned. And due to being an oncology institute, I mean, we have a lot of different variety of specimens, and we are lucky enough to have almost every kind of tumor which comes to us on almost every daily basis, because there are some rare tumors, but still we have this handsome workload and variety, and as a result the training in pathology is just outstanding. I have been here since 2018. I was a resident from 2018 to 2022 over here, and now right now I am doing my cytopathology fellowship here at Shaukat Khanum. So this is going to be our agenda for today. We are going to go through some basic introduction of pathology as a field, that how exactly can you be a pathologist, and when you think about pathology, what exactly are you thinking about? Then we are talking about the subdivisions of pathology, and then the career pathways in pathology, and then research and higher training opportunities, and the future of pathology, that is digital pathology and AI as well. So let me, okay, sorry. So what exactly is pathology, and what are the idea, what is the idea of when you think about pathology? At undergraduate level, we have this general perception, okay, pathology is just a subject that is being taught in third and fourth year. Yes, it is related to diseases, how to diagnose it. But generally when we talk about pathology in general public, what we find is that people think about pathology as people running labs, doing tests in labs, and blood tests, urine tests, and some other fluid tests as well. So it is a very general perception of pathology that okay, they just deal with different body fluids, and they just run specimen on different machines, and then they get the result out. So there is nothing really charismatic about pathology in general population, and as a general view as well. Then we come to the clinical view, what clinicians think about pathology as a field and pathologists in general. So yes, they know that pathologists are dealing with different specimen and different fluids and different diagnostic things, but still they do not really understand what meticulous things that we go through as a pathologist, and how important is the role of pathologist in helping them diagnose the disease. It is not just about the blood test or giving different parameters, but it is also about how we guide the clinicians to just make a diagnosis and get on with things and treatment as well. So the role of pathologist is very critical. And now how this presentation is going to be telling you about is going to be about what actually a pathologist and the role of pathologist is, and how important of a field is pathology is in medicine in general. So when you talk about pathology, and generally as a medicine as a field in general, you need to have a diagnosis to treat a patient. You are dealing with patients, they have some illness, but you need to just diagnose things. And at the end of the day, pathology is the field that can provide you with a certain diagnosis and a definitive diagnosis. A medicine physician or any medicine related field, you can think of a gastroenterologist, for example. So some patient comes to him with some abdominal pain or some upper GI symptoms, and then what he does is that he ordered blood, CBC, and LFTs and RFTs, and he does endoscopic biopsies as well. And those biopsies come to the pathologist, and they provide them the diagnosis: is it just gastritis or is it something else? And the CBC and LFTs and RFTs are also helpful in the manner to diagnose any other pathology that there would be. Same goes for the surgery. A surgeon needs a tissue diagnosis to get on with the treatment. And when he has done the surgery, the specimen comes to pathology, histopathology in particular, and the surgeon would require the pathology report to understand if the surgery has been adequate, what exactly has been the diagnosis in the surgery, and is there a need to do anything more about it from a surgical point of view when it comes to the report or patient pathology. For example, there's a patient of breast carcinoma. The surgeon, when he has done the surgery, would want to know what exactly is the diagnosis. Are the margins clear? What is the lymph node status? So a lot is being expected from a pathologist and surgeon. If there is some margin positivity, is if there is DCIS, which is in situ tumor, which is close to the margin, then they need to go in again and re-excise again. So that is where when comes the role of pathology, that pathologist is actually helping them making decision about treatment of patient. And radiology as well. I mean, no offense to radiologist. I mean, a lot of my friends and my family friends are radiologists, but definitely radiologists have their limitations as well, that they, yes, they can tell you that there is some mass or there is some lesion going on in the body, but they sometimes, yes, they can exactly point out what exactly is the pathology, but usually they have to give differentials. For example, in brain tumor, they can tell you that it is an intraaxial tumor, or it is something in the brain cortex or in the medulla or in intraventricular location, and then they give you differentials which are very valid differential and which are very helpful for us. But for definitive diagnosis, a tissue biopsy is required. So pathology is at the center stage of medicine, to be honest. I mean, not bragging about it, but just something that I have learned over years, that every doctor requires pathology to make a diagnosis, to treat, to help them in treating the patient and in guiding them as well. And with advances in pathology, right now, what I have seen, and especially in oncology, that pathologists are actually leading the discussions in multidisciplinary meetings and telling them about new entities, telling the oncologist and telling the doctors that, hey, this is the new entity that we have introduced. Our international colleagues have found out this about this entity, the prognosis of this entity. So pathologists are actually now taking a lead role in guiding the principles of treatment. So pathology role is, I mean, the main part in diagnosing as well as treating the patients. So when you come to, just an introduction to pathology, and you are deciding, you have done your house job, you are now deciding that now I have to, go into pathology. So what exactly are different subdivisions of pathology? You have hematopathology, that is hematology, histopathology, that is tissue biopsy pathology, and microbiology, which is dealing with microorganism, the cultures, and chemical pathology and molecular pathology as well. So these are the five main divisions of pathology. When someone chooses a career in pathology, they have to decide in what field of pathology do I have to go. And post graduations are available in all of these fields of pathology. I will be dealing with hematology and histopathology in detail, just telling you about microbiology. Microbiology, as you know, deals with different cultures, and it is very important for infectious diseases people as well to help them diagnosing different kinds of infections. And microbiology is something that has taken a very vital role when it came to corona and other pandemics as well. So microbiology is something that deals with cultures and diagnosing the infectious diseases. Chemical pathology is the usual pathology, the pathology that every common layman knows about. Different lab tests, different machines, the LFTs, RFTs, and different specialized tests as well. Chemical pathologists are very important in a sense that they are getting the most load in a pathology laboratory, and they have to make sure that their results are optimized. And they also provide you comments in the note. The good laboratories and the good chemical pathologists provide you with a comment that, hey, LFTs are deranged, so you have to think about this. Hey, this particular parameter is deranged, so you have to think about this particular pathology. So chemical pathology is more related to the usual, special, and the routine blood tests and the chemistry tests. And molecular pathology is an ever-growing and advancing field. You have new things coming up in as far as PCR is concerned, as far as fish is concerned, and many other new techniques are coming in. And molecular pathology goes very at the basis of genetic level to diagnose things, to diagnose mutations, and to provide definitive diagnosis. It is a very charismatic field, but it is a little expensive as well. So usually molecular pathology is someone who gets the least amount of workload and requires very high standard organization, heavy investment as far as those machines are concerned. So that is why in Pakistan particularly, molecular pathology is really not up to the mark as compared to the other countries. We have good institutes like Shaukat Khanum, and Agha Khan and Shifa and a few others as well who have started this trend of introducing new techniques, the worldwide techniques in molecular pathology. But other than that, I mean, most of the usual laboratories and even the government hospitals do not have those molecular pathology facilities. So molecular pathology is something that is at least 10 years behind the world, what I would say, and needs to be focused on in Pakistan. So moving on to the more common fields of pathology, hematology. As we know, hematologists are the people who actually deal with blood and bone marrow, and they diagnose different kinds of non-pathological and pathological entities. These are just some fancy machines. This is a flow cytometer. This is a flow cytometry machine which is used to diagnose different leukemias and subtype them. This is the flow chart that they get out of it, and this is an automated CBC machine as well. So the hematopathologists are primarily dealing with the blood samples, the bone marrow samples. This is a bone marrow biopsy. There is some fatty infiltration, um, no particular neoplastic lesion in this one, as far as I think so. As far as my limited knowledge is, but so they deal mostly with blood CBCs, that the peripheral smears. And I think that hematopathologists are very critical to any laboratory, because when you are dealing with a hematology, you know that most of your workload is going to be CBCs, peripheral smears, smears for dengue, smears for malarial parasite, and yes, leukemias as well. So any lab would requires a hematopathologist, even if it is a small setup private lab, or it is a big setup. Hematopathologist is very important, as they have to deal with routine, more commoner blood tests, and they have to provide diagnosis on daily basis of dengue and malarial parasites and RBC morphologies as well, to diagnose different kinds of anemias, which is very common in our country. So hematology is something that is very, very commonly needed, and hematopathologists are required all over the world. It is a very good field. If at undergraduate level you are thinking to get into pathology, but you don't want to go in a very difficult or very cumbersome histopathology field, because histopathology is definitely very demanding. Hematology is somewhat relatively easier, but it is something that has a lot of importance, that is evolving over time, and new techniques are coming in. So hematology is something that you need to consider when you are thinking about pathology as a career. So histopathology. So this is where I come in. I mean, this is the basic area of histopathology. I mean, most of you will be thinking, I mean, what is this? What we thought that histopathology is, those slides under microscope. You have weird kind of things going on under the microscope, and this is all pink and blue. Yes, that is histopathology, but that particular slide is made over here. So this is a grossing table. This is a grossing station. This is where all the specimens from all the surgeons come in. We have thyroid, we have breast, any kind of organism, any kind of organ, sorry, any kind of organ will come in over to us, and we residents and fellows of pathology would gross it. Grossing, we mean dissecting it, taking the representative sections, and then processing it so that it becomes a slide. So this is the gross room, that where it all starts. Histopathology starts from the gross room. So yeah, this is me doing grossing. This was, I think, my first year or second year of my residency. So as you can see, this is right here. This is a thyroid specimen, and I have, serially sliced it and inked it, and, I'm taking sections for slides to be processed. And then these steps come that you have slides, and then when you put it under microscope, you see different kinds of tumors. Obviously, I'm not going to go in detail of different kinds of tumors, but this is papillary thyroid carcinoma, the orphan NEI nuclei that we were so much taught in undergraduate level and fourth year. So this is what histopathology is all about, that you get the specimen, you slice it up, you get the sections, and you have different international protocols like College of American Pathologists and Royal College of Pathology UK, and they have guidelines to how to grow specimen and how to look about it under the microscope and how to report it. So we at Shaukat Khanum are following all the international guidelines, and we are diagnosing all kinds of tumors based on those guidelines. And then comes the next step. Just looking at the microscope and looking at the slide isn't enough. You need to have immunohistochemical stains to diagnose different varieties of cancers. You have like thousands of tumors now, benign and malignant, and you have to particularly, and you are expected, especially at a tertiary care level, at a level of Shaukat Khanum or any good institute, that you diagnose and give a definitive diagnosis to the clinician. And for that, you need immunohistochemical stain. So this is a squamous cell carcinoma. You have an HNE. This is a squamous cell carcinoma. And this is P40 stain, nuclear positivity. This brown positive is the nuclear positivity of P40. And this P40 is a very specific marker for squamous cell carcinoma in the right settings. So immunohistochemical stains are something that add to the effect of histopathology and provide you with exact diagnosis of what exactly this tumor is going to be about. So this is the advancement that the world has seen over the last a decade or so. We did not have immunohistochemistry 20 days back, 20 years back, but in recent years, immunohistochemistry has become very common and is available at most of the good institutes in pathology and in pathology in Pakistan and internationally as well. And this is something that is very important for us. So again, going on to the next step in histopathology, from immunohistochemistry, we have immunofluorescence as well. So this is IgG, nice granular positivity of on immunofluorescence for membranous nephropathy. Moving on to what career pathways are present in pathology. In Pakistan, you have 3 degrees that are available. You can do FCPS by doing part 1. You can do MPhil in pathology. You can do DCP. Naturally, FCPS is preferred over MPhil and DCP because it is recognized in Pakistan, all over Pakistan, and internationally as well. So if you have to go to USA, you have to do steps. You all know that. You can go into pathology, you can give interview, you can become a Diplomate American board, and then you can do particular fellowships in breast pathology, in other fields of pathology, and they have super specialties as well. So, and relatively match in pathology is easier in US as compared to medicine and other fields. And as far as UK is concerned, you have the Royal College of Pathologists, which offers FRC path. So what you do is that you do the lab, you do foundation year, you apply for a training post in pathology in UK. You do a 1 year training in pathology, and then you can appear in FRC path part 1. And after that, you need a couple of years of training, and then you can appear in FRC path part 2. That degree is then recognized all over the world except for US, and you can go work as a consultant anywhere in the world if you have FRC path. So these are the 3 major areas, 3 major pathways that you can follow at undergraduate level. If you want to stay in Pakistan, definitely go for FCPS part 1 in pathology. Then you can apply in directly to the institutes like Shaukat Khanum, Chugtai, Khan Shifa, and other institutes, or you can take the CIP pathway to apply in government institutes. But definitely, private institutes have better facilities, better training opportunities. So I would definitely recommend that you prefer private institutes right now, because unfortunately, our government institutes do not have those much facilities like immunohistochemistry and immunofluorescence, etc. And as a field in pathology, you have a lot of research opportunities. I mean, your guidelines aren't really fixed. You are ever evolving. You are getting new and new things every day. So there are so much research opportunities that you can just do in field of pathology. There's molecular pathology involved as well. You can go for immunohistochemistry on different tumors. You have immunotherapy like PDL1 coming up in different tumors, and you can do IHC to confirm it. So there are a lot of research opportunities that are there in pathology. And yes, when you become a pathologist, you can go for second fellowships, just like I am doing. I'm doing a second fellowship in pathology in cytopathology, and it is now being recognized by CPSP as well. So you have internationally, you have many other fellowships as well. Online fellowships are available as well, and subspecialty trainings that you can actually train in the field of neuropathology and any other pathology for a particular amount of time and get a degree out of it. Like if you do a fellowship in cytopathology, you will get double FCPS and another degree related to it. So there are a lot of opportunities, and pathology is an evolving field, and that is why you have a lot of opportunities and future in here. As I was talking about these opportunities, this is UT San Antonio back in 2016 when I rotated in hematopathology as an elective student. Dr. Kenneth Holder was my supervisor, and it was a great 1 month rotation. So you have those electives opportunities internationally at an undergraduate level. You need to apply in fourth year to get an opportunity like this in final year, and this kind of opportunity and elective when you do it in final year or even after post graduation goes a long way in your CV. I mean, this particular rotation has helped me get into Shaukat Khanum, and obviously build the CV, because when they see that this person is serious and this person has an international experience, they just they get the idea that it would be a good thing to hire this person. So definitely rotations in pathology are offered, and they are offered in university programs. They are offered at good places, and I think at undergraduate level you should do an electives, and even Shaukat Khanum offers electives for undergraduate students in pathology. So you can definitely choose that opportunity and can apply in Shaukat Khanum and get an electives experience at pathology, so that you get a first-hand experience of pathology. And I was talking about the research here. You can see that I presented these two papers in as an abstract, as a poster in ESPC, that is Emirates Surgical Pathology Conference in Dubai in 2021 December, and I won the award for this C4D, this renal pathology poster. So this is something that so many conferences are going on, so much is going on in the field of pathology, and you get to meet international authors, international people. That makes you just so much into this field of pathology, and you are so excited to get these kinds of opportunities. And lastly, the future of pathology. So future of pathology is evolving. We have gone to the era that is going to, and that has introduced digital pathology. Digital pathology is just like when radiology was used to be reported on films, and then they got the computer screens and the software to view all the scans. It is exactly the same. You scan the slides, it all comes out in a form of a very nice high resolution picture, and then you can zoom in, zoom out, do the immunostains on there, get the pictures of immunostains, and report it out online. So it is pathology in next few years is going to be online. Microscopes are going to be relatively out. Maybe they will need it someplace in smaller laboratories, when in next 4 or 5 years pathology is going to be online, and artificial intelligence is also taking place. And in artificial intelligence, the computer predicts by seeing at the algorithms and the morphology of the tumors, and it predicts that how much chance is there that this particular tumor is a malignant entity or not, and what kind of tumor it is. So this is also a screenshot of a digital pathology, virtual pathology library at University of Leeds. It is publicly available. So you have a lymph node over here. Some toxoplasmosis changes are there. So, but it is essentially a reactive lymph node with changes of toxoplasmosis. So this is the screen that you are going to get in next couple of years in most of the institute of the world, and inshallah in Pakistan, major institute of Pakistan as well, that they are going to be digital and they are going to be viewing the slides on the computer screens. So at the end, this is the end of the talk. This is my message for all of you that yes, your career is important, but uh, love, laugh, and live. This is so important that you need to live your life. You need to be happy, and you need to, just pursue career at your point. I understand it is a very difficult time when you're choosing a field. You are overwhelmed by things. There is a lot of competition these days, but you just need to live your life, live happy. This picture was at Gili Mino. I went there in 2019 in Bali, Indonesia, and this is just an outstanding place. So anyone wants to contact me, anyone needs a guidance, they can email me. They can get my number for Usama. Just if they need to get in contact with me, I will be more than happy to help. I'll be more than happy to guide you if you want to choose pathology as your field. Again, I would like to thank the organizer, Muhammad Usama, and his team for inviting me for this fantastic presentation. And this is a very nice gesture from him. And this is a good thing that they are promoting awareness about pathology. So thank you again, everyone. Hope you had enjoyed the time. Please contact me if you need anything from me in terms of guidance, in terms of pathology. I will be more than happy to help you guys. Thank you so much again.
Thank you, Sharifa. It was a very comprehensive presentation, and we will also upload it on YouTube. And I think Ahmed Ali had a question, and you can just raise hands, and I will unmute you, and you can ask the question. So, Ahmed Ali, okay, you can ask your question now.
भाई आई वांट टू आस्क के जो दो पैथोलॉजी के पाथवेज हैं यूएस में फर्स्ट